Hello and welcome back. It's Andrew Eborn here, looking at the future of dentistry and orthodontics with Claire Nightingale. How's it going, Claire?
Hi, all great, Andrew. Thank you very much.
Good.
So, Andrew, I asked you to have in your mind the last photograph. So she's on a line of 14. I wanted you to remember how her teeth were looking at that point, and I want you now to come back to the ClinCheck. Now, I've cleared off the attachments and the volume of filing that needs to be done to try and make a like-for-like comparison. And I'm really impressed. This is for me the wow moment. So I set up her treatment in the hope that when she got to a line of 14, this was how her teeth were looking. And now I've referred back to her photographs that she sent to me through the dental monitoring site. We've not been able to see each other during lockdown, but nevertheless, I know that her treatment has really progressed as I was hoping. So here we are now, look. So the computer generated image pretty much matches the reality, both in terms of her bite with her teeth contacting, both at the front and at the side, with the alignment of her teeth, and indeed what I had intended to leave unchanged has remained unchanged. So altogether, I call that a complete and utter wow.
And the great thing is it's managing expectations, it's in providing efficiencies because you know when extra treatment is done, and also a carbon footprint. The patient can stay at home for a lot of these things rather than coming to see you.
That's absolutely true, but I will say that there is a massive carbon footprint behind the manufacturing and the shipping of this appliance. So, you know, I think we can look at it as an absolute win on minimising aggravation for the patient, minimising the contact between a patient and a clinician at a time when we've got a pandemic. And indeed, this is the future. You know, so, you know, this, I mean, I'm not going to suggest for 1 minute that traditional orthodontics is over. It's not, because quite clearly there are going to be malocclusions that we just cannot treat in any other way at this moment in time and for the duration, as I would see it, the rest of my career, for sure. But nevertheless, I do genuinely believe that this is the now, and this is absolutely the future. I think
and also what it does, it opens up a whole new world. Clients around the world could be able to benefit from these services as a result.
Who knows? The world is my oyster.
The world is your lobster. I love it. The lobster third was good. Now, a couple of stages in this, you were just going to show us how you actually did it.
Yes. Okay. So let's come back to some different photographs now. Okay. So here we go. Oh, yes, you can see this now. So these are the photographs that we took to demonstrate the mechanics. So what you see here, so you see the clear plastic aligners, you see the little attachments that are on her teeth. So, you know, you have to look hard to see them. You know, from a practical point of view, we can see them as little indentations in the plastic. And from her perspective, when she takes the aligners out, they'll feel slightly rough against her lips. And I'm advised that it's a very good incentive to get the aligners back in again. But compared to wearing a fixed brace, it's really phenomenally aesthetic. And what I'm doing mechanically, here are the elastic bands. So if you remember, I showed you at the start that we were going to put some little buttons on cutouts on her molars. And from that, she was going to run an elastic band to little cutouts in the aligner. So here is the conventional orthodontic pulling force using elastic bands to move teeth. But here is the efficiency of the treatment. Well, another efficiency of the treatment is that with the clear aligner therapy, I can start to achieve multiple tasks in one go. So I can straighten the teeth and I can start putting a corrective force using elastics to correct the malocclusion, correct the bite simultaneously. But I can't do that in fixed braces, because with fixed braces, I have to go through a sequence of getting the teeth straight first, using very light wires, and then building up to bigger wires to support the force of the elastics. And of course, I can't build in the unwanted effects, avoiding those. So with this approach, we've got aesthetics, we've got comfort, we've got convenience, we've got the ability to monitor somebody remotely, we've got low aggravation, low breakage incidence with aligners. But In addition, we've got all the additional mechanical flexibility, so avoiding unwanted tooth movement, being able to multitask and achieve multiple treatment goals simultaneously. So, you know, it's a real win. It's a win for me, it's a win for her. I could not have delivered her treatment outcome in 4 months by conventional means. So it ticks every box.
And you mentioned that the ultimate aim was getting married with wonderful teeth. When's the wedding due to take place? What's going to happen?
That I can't remember. And indeed, who knows, in this time of COVID, so many plans have had to be put on ice, haven't they? But one thing we can be certain is when she gets married, she is going to have an absolutely wow smile.
So happy all round. And I think it is, as I say, it is phenomenal seeing what's possible and the ability of AI to help add those efficiencies to your work is absolutely tremendous. So thank you very much for sharing that. I'm delighted that not only is AI in the centre of your name, Claire, but it's now at the centre of your practice going forward as well. So for now, Nightingale, thank you very much for joining us.
You're very welcome, Andrew. See you again.
Thank you. Bye-bye.